Hi, welcome back. My name is Dr. Michaela Andrean, and I am an acupuncturist. I'm an athletic trainer. I am an NAT practitioner, all things alternative and holistic. And so I am creating this YouTube channel for my fellow acupuncturists, my fellow acupuncture students, because I felt like I needed more support when I was going through school, but nobody was making this type of content where it's just kind of following a class and helping you dive deeper into it all. So, my series has kind of been focusing on channel theory because a lot of people are not familiar with how channel theory can be treating so many things. I feel like my practice uses mostly channel theory because channel theory is based off of anatomy and understanding how imaging and mirroring flows, along with understanding the functions of each organ, and then making that into a channel, which would be our bracketed channels, and diving deeper with all of that. So today I want to just kind of expand a little bit more on channel theory and how we can be using this. So last video was about how imaging and mirroring flows. So let's just recap that. Obviously my left hand could be used to treat my right hand. And so once a needle is in there, I could be moving, being okay, the pain moved down my wrist. Okay, let's go there. Okay. And just kind of immediately seeing the shifts and the changes. So this is going to be considered a static treatment, and it's going to be used for localized pain. Compared to, as we go deeper into channel theory, we have dynamic treatments, which will be systemic autoimmune type of conditions. Okay, so again, just focusing on the static or the localized issues, then imaging is fantastic. So a hand for a hand, elbow for elbow, shoulder shoulder, same thing with the lower body, just kind of going opposites. Another way we could be doing this is hand to foot, elbow to knee, shoulder to hip. And again, all those joints and the movements, anatomy wise, is very similar too. So, how we have our phalanges, how we have our metacarpals and our metatarsals, our carpals and our tarsal bones, the anatomy really starts to feel the same. Two bones, we have two bones as our tibia and fibula. We have our humerus, and we have our one bone as our femur. We have a ball and socket in our femur. We have a ball and socket in our shoulder. So it all just kind of starts to go like that. Our scapula, our shoulder blade, is a flat, smooth bone. Our hips are seen as a flat, smooth bone. So you can just start to see all the similarities. We have 3 tricep muscles. We have 3 hamstring muscles. We have around our shoulder, we have large muscles called our deltoids. It's the same around our hips. We call those our glutes. And so you can just start to kind of see like the similarities within it all, okay? And so that is just going to be pure like imaging of like this looks the same, so it's going to be used the same. We also have something with imaging where my hand can image my face and my head, and so that is a way of this is my lungs, or this is my lung meridian, which opens up to my nose. This is my large intestine, that's my yang ming headache. This is my jue yin headache, my xiao yang headache, and my tai yang headache. And see that all of these meridians are aligning with this image of how we already view the head. Okay, so that is just like a way of flowing and using this. We could also say that our elbows are our eyes. Same thing with like stomach 35 and stomach 36. Stomach 35 is called your calf's nose. And so think like imaging wise, we always say that the knees and the elbows are the eyes. And so if stomach 35 is just below the knee, then that's our nose. That's our nose, the calf's nose. So imaging all just starts to like make more sense and help you support the energetics of everything. So that's our recap. I'll have our little images up there too. But what is going to be new and what we're going to talk about today is going to be how there's systems in place of channel theory. So now with channel theory, we have these different systems that we're also going to be used in place. And this is going to help us enhance the same concept of things look similar, but we're going to deepen that. Okay, so if you don't know your anatomy, then we're going to go just based off of a true TCM perspective, and this is going to be ways to help support you. So system 1 is going to be the same name, okay? There's going to be 5 systems. Some people say 6 systems, and we'll break that all down. So system number 1 is going to be the same name. So what that means is within our little brackets of our channels, the same name will be Tai Yin. So lung and spleen, that's the same name of Tai Yin. So those 2 meridians can be used to treat each other. So my lung meridian is going to be on the radial side of my hand. And if I want to work on my spleen, then it's going to be, think about this as my great toe. My spleen 1 and 2 and 3 and 4, 5 all come up into the same part of my great thumb. So the images are all together, okay? So this again should like help you start to reinforce the same concepts, that the body is connected and reflexology is working full system, all these things. So system number 1, same name. So spleen and lung, we have our Yang-Ming and so forth, okay? With that, just make note that that's always hand to foot, right? So again, in our little brackets, it's always going to be a hand meridian to a foot meridian, and those channels are connected. Our system number 2 is going to be the branching name. So we have yin and we have yang, so we're going to take the same prefix of the name and then add the opposite ending. So Tai Yin is now going to Tai Yang. So Tai and Tai is still connected. They're just being interchanged of hand Tai Yin to foot Tai Yang. So this is still hand to foot within the system branching name. So hand Tai Yin is going to be my lung. Foot Tai Yang is going to be my UB. And so I could use my lung meridian to treat my UB meridian. Okay. Again, this is all going to be here for you to see. And we'll go through some examples and we'll go through it all, okay? It's going to be interior, exterior. So we have our lung going to our large intestine. So do you guys see why the initial mapping of everything is just so important? Because we're pulling our brackets, we're pulling the flow, everything is coming from that image, okay? So if you know that image really well, now everything's just like, okay, great, I can just map that out, and now I can understand my 5 systems. So system number 1 is going to be same name, system number 2 is branching name, system number 3 is going to be interior, exterior. So lung to large intestine, stomach to spleen, and so on. So that means that if my lung is my hand Tai Yin, I can now go to hand Yang Ming. Okay, which it is also cool because we see like common point combinations within these channels anyways. So we have like our host and guest, because host and guest is going to be using the source along with the low, and those can be used to balance out a lot in the body. So going into system 4 now, we have clock opposites. Okay, so again, just staying on our hand Tai Yin, this is going to be 3 to 5 a.m. So now we're going to 3 to 5 p.m. And 3 to 5 p.m. is going to be foot Tai Yang or UB. So in this example, you can see that UB is also within the branching name. So you can start to see that UB and lung are great partners for each other because there's multiple ways that they're connecting within this pairing system, okay? So then the system 4 is clock opposites, and then system 5 is going to be the clock neighbor of the same polarity. And what that means is, again, our little clock is just flowing, And so it needs to be the same polarity of yin to yin, yang to yang. So going to hand tai yin, the neighbor would actually be jue yin. Because remember, once we zigzag all the way through, jue yin goes back up into the lung meridian. And so that's how it flows. Same polarity is what throws a lot of people off. It's not just going to the next organ, but the same polarity. Okay. So you can see with like tai, so han tai yin, the neighbor is jue yin, but jue yin, the neighbor is shao yin. Okay, so again, as we're just flowing, shao yin is dropping down to jue yin. So it still has to follow the same flow. So it's basically like who's feeding into the next organ. That would be the neighbor. Okay, so good. This is a lot to go over and to understand. And so, again, just keeping it basic, if you had pain in the lung meridian, I can now be using multiple ways. Let's just talk about the sixth system real quick, because some people will say that there is a sixth system. The sixth system is going to be the same meridian. So same side is hurting, I would just do the lung on the opposite side. So we've already basically talked about that through the imaging, okay? So system 1, same name, so I could use my spleen. System 2, branching name, I could use my, so since I'm on my hand, I'm going to use my foot, tai yang, which is my UB. Third system is going to be internal external pairs. So instead of my lung, I'm going to use my hand, yang ming, which is my large intestine. My fourth system is my clock neighbor, or my clock opposite, so AM to PM, and that will be my foot tai yang as well, so that's UB again. And then my fifth system would be my clock neighbor, which would be jue yin flowing into tai yin, because those are the same polarity. Okay, good job. So let's go through some examples, because again, that will just like help us reinforce all of this. So the best way to go about doing an example, and again, I'll have this pulled up, is going to be if you have right leg sciatica pain, and the affected channel is going to be your foot shao yang, so our gallbladder channel, to map out systems 1 through 5. So again, system 1, what would that be? 2, 3, 4, 5, and just like look at those. And then once you determine what potentially are your treatment channels, now think which one makes the most sense through imaging and mirroring. Because like Sanjiao and gallbladder, since those are paired in system number 1 of same name, then those can be a fantastic way of working on, you know, if this is my hip, of working down that lateral arm, and then again having them walk and stretch and see like has their sciatic pain shifted and moved. So that's just like one way of doing it. And so you can just start to see like what is going to be your best options, and you just start to like think like that, okay? And technically, none of these are wrong answers. You just have better options once you start to like look at it all. The amazing thing is too, is with applied channel theory and these localized treatments, you can have them be walking and moving around. So you could be using the arms and the legs and having them stretch and move while working on all 5 of the systems if you need to. Typically, you don't use all those, you know, less is more. And so once you find the pain is reduced and the pain is gone, then you'd be done, and you'd like let them just like relax and hold that treatment for a little bit. You don't just like keep needling to needle. I've always been taught, and even in textbooks will say this, if you hit the bullseye and the pain is gone and the symptoms are relieved, you don't have to continue to throw the darts, just to let the body relax and unwind. So another example we could look at is saying somebody's coming in with right arm lateral elbow pain. So like a lateral epicondylitis type of issue. So tennis elbow. And so with this, let's say it's in between two meridians. So let's say it's in between our hand xiao yang, so our sanjiao, and our yang ming, hand yang ming, so our large intestine. So between the sanjiao, like 10 area, and large intestine 11. So it's just around that area in between those two. Now what you would do is you'd look at both of those meridians and you'd write out system 1 through 5 of what the pairings would be for, okay, same name, branching name, internal, external pairs, and you're gonna get all these options. You're gonna have 10 different things written down. So 5 options for Sanjiao, 5 options for large intestine. And now what you would do is you would see if anything has those in common. So you could say, okay, well, gallbladder is used in, once all those are all written down, you look and see what is the same. So in this scenario, foot xiao yin is the commonality of both of those. And so you could really be working on foot xiao yin to then, okay, let's put needles, and that's our kidney meridian. And so put the needles in there, and then again, moving our elbow, twisting, turning, like what are you feeling? How is everything? And then if that does not resolve all the pain, then kind of seeing, okay, well, foot xiao yin is yin, and that's pretty deep. What if we just switch meridians and we go more on the yang side of the leg? Are there anything else that pair up for both of those? And just kind of working your way out like that. So I'm going to post more examples and let you just kind of like see what the answers are and like help support all of this. And just remember, there's so many options with channel theory and with an acupuncture. So best of luck. I hope that your patients are feeling amazing. I hope that this is all making sense, and I will see you soon.